Hello all. Today we are going to study one of the most clinically important and very commonly used groups of drugs in pharmacology, and that is sedative and hypnotic agents. Before we go into drugs, I want you to think about something very simple. After a long and stressful day, when a patient goes to bed, what is the most natural process that happens? The answer is sleep, right? Now I want to ask you one important question. Is sleep just a passive process, or is it an active and regulated physiological function? Sleep is actually a highly organized and active process controlled by the brain, involving multiple neurotransmitters, receptors, and neural circuits. So, when we talk about sedative and hypnotic drugs, we are not simply talking about drugs that make a patient sleepy, right? But we are talking about drugs that modify a very complex neurophysiological process. Let us begin by understanding the basic difference between sedation and hypnotics. Sedation refers to a state of decreased activity, reduced anxiety, and calming the mind in which the person is relaxed but still awake and responsive. Hypnosis, on the other hand, refers to the induction of sleep, which resembles the natural sleep but is produced by drugs. So, same drug can act as a sedative at a lower dose and as a hypnotic at a higher dose. This is a very important concept that you must always remember because it explains why these drugs are dose dependent in their actions. Now, let us go one step deeper. To understand how these drugs work, we must understand how the brain controls wakefulness and sleep. In the brain, there are specific areas responsible for maintaining alertness, attention, and wakefulness. And the system is known as the reticular activating system. At the same time, there are inhibitory systems that promote sleep and reduce neuronal activity. The balance between excitatory and inhibitory signals in the brain determines whether a whether a person is awake or asleep. Now I will ask you another question. Which neurotransmitter is mainly responsible for inhibitory activity in the brain? The answer is GABA, which stands for gamma aminobutyric acid. GABA is the major inhibitory neurotransmitter in the central nervous system. When GABA binds to its receptors, it reduces neuronal excitability and produces a calming effect. Most sedative and hypnotic drugs act by enhancing the actions of GABA in the brain. Let us understand the mechanism in detail. Okay, so GABA act on GABA receptors, which are ligand-gated chloride channels. When GABA binds to these receptors, chloride ions enter the neuron, making the inside of the cell more negative. So this process is called hyperpolarization. When the neuron is hyperpolarized, it becomes less likely to fire on action potential. As a result, neuronal activity decreases, leading to sedation and sleep. Now, sedative and hypnotic drugs do not directly produce this effect on their own. Instead, that enhances the actions of GABA by increasing the frequency or duration of chloride channel opening. This results in increased inhibitory effect in the brain. So, different classes of drugs act at different sites on the GABA receptors. For example, benzodiazepines bind to a specific site on the GABA receptors and increase the frequency of chloride channel opening. Barbiturates, on the other hand, increase the duration of chloride channel opening. This difference is very important because it explains the safety profile of these drugs. Next, the benzodiazepines have a ceiling effect, meaning that their effect is limited by the availability of GABA. Whereas barbiturates can directly activate the receptor at high doses, it leading to severe central nervous system depression. That's why benzodiazepines are considered safer compared to barbiturates. Now let us understand what happens clinically when these drugs are given. At low doses, these drugs produce sedation, which means the patient becomes calm, relaxed, and less anxious. At moderate doses, they produce hypnosis, which means the patient falls asleep. At higher doses, they can produce anesthesia. At very high doses, they can cause respiratory depression, coma, and even death. So you can see that these drugs have a dose-dependent spectrum of effect, starting from mild sedation and progressing to severe central nervous system depression. This is why it is very important to use these drugs carefully and monitor the dose. Let us talk about the ideal characteristics of a sedative and hypnotic. An ideal drug should produce natural sleep, should not alter the normal sleep pattern, significantly should not cause hangover effect in the morning, should not produce dependence, and should be safe even in higher doses. However, in reality, no drug is perfect and each class of drug has its own advantages and disadvantages. Now, let us begin with one of the most important classes, which is the benzodiazepines. Benzodiazepines are widely used because they are effective and relatively safe. Examples include diazepam, lorazepam, alprazolam, and midazolam. These drugs act by enhancing the effect of GABA at the GABA A receptor, leading to increased inhibitory activity in the brain. Clinically, benzodiazepines are used for the treatment of anxiety disorders, insomnia, seizures, muscle relaxation, and as pre-anesthetic medications. One important property of benzodiazepine is that they reduce sleep latency, which means they help the patient fall asleep faster. They also increases total sleep time, but they may alter the normal sleep architecture by reducing REM sleep. Now let us talk about tolerance and dependence. When benzodiazepines are used for a long period, the body adapts to the presence of the drug and the effect gradually decreases, which is known as tolerance. At the same time, the patient may develop dependence, meaning that sudden withdrawal of the drug can lead to withdrawal symptoms such as anxiety, insomnia, tremors, and even seizures. Therefore, these drugs should not be stopped abruptly and should be tapered gradually. Now let us briefly introduce barbiturates. Barbiturates were used widely in the past as sedative and hypnotic drugs, but their use has declined due to their narrow therapeutic index and higher risk of toxicity. These drugs can cause severe respiratory depression, especially in overdose, and they also have a high potential for abuse. Because of this risk, benzodiazepines have largely replaced barbiturates in clinical practice. At this point, I want you to pause and think about what we have learned so far. So we started with understanding sleep as a physiological process. Then we learned about the role of GABA as an inhibitory neurotransmitter. And finally, we understood how sedative and hypnotic drugs enhances GABA activity to produce their effect. This foundation is very important because once you understand this, the rest of the topic becomes much easier. Let us begin by revisiting benzodiazepine because they are the most commonly used sedative and hypnotic drugs in present-day clinical practice. Benzodiazepines are a preferred over older drugs because they have a better safety profile and a wider therapeutic index. When a benzodiazepine is administered, it is usually well absorbed from the gastrointestinal tract, especially when given orally. And it reaches a peak plasma concentration within a few hours, depending on the specific drug. These drugs are highly lipid soluble, which allows them to cross the blood brain barrier easily and produce their central nervous system effect. Once inside the brain, benzodiazepines bind to a specific site on the GABA receptor complex, which is different from the binding site of GABA itself. So, by binding to this site, benzodiazepine increases the affinity of the receptor for GABA, meaning that even small amounts of GABA can produce a stronger inhibitory effect. This leads to increased frequency of chloride channel opening, resulting in hyperpolarization of the neurons and reduction in neuronal excitability. Now, it is important to understand that benzodiazepine do not directly open the chloride channel in the absence of GABA, which is why they are considered safer compared to barbiturates. Let us now talk about the classification of benzodiazepine based on their duration of action. Some benzodiazepines are short-acting, some are intermediate acting, and some are long-acting. Short-acting drugs such as triazolams are mainly used for sleep induction because they help the patient fall asleep quickly but may not maintain sleep throughout the night. Intermediate action drugs such as lorazepam are commonly used for anxiety and insomnia as they provide a balance between onset and duration. Long-acting drugs such as diazepam have high metabolites and can remain in the body for a longer duration, which makes them useful in conditions like anxiety disorder and muscle spasms, but they may cause daytime sedation or hangover effect. Next, let us move to the another important group of drug known as Z drugs. This includes zolpidem, zolpidem, and azopiclone. Although they are structurally different from benzodiazepines, they act on the same GABA receptor complex but with greater selectivity for certain subtypes of receptors. Because of this selectivity, Z drugs primarily produce hypnotic effect with minimal anxiolytic, muscle relaxant, or anticonvulsant actions. This makes them particularly useful for the treatment of insomnia. And Z drugs have a rapid onset of action and relatively short duration, which reduces the risk of daytime sedation. However, they are not completely free from adverse effect, and some patients may experience dizziness, headache, or abnormal behavior such as sleepwalking. Next, barbiturates were once widely used in sedative and hypnotic drugs, but their use has significantly declined due to safety concerns. These drugs enhances GABA activity by increasing the duration of chloride channel opening, and at high doses they can directly activate the GABA receptor even in the absence of GABA. This property makes them more dangerous because they can cause profound central nervous system depression. Barbiturates also have a narrow therapeutic index, meaning that the difference between therapeutic dose and toxic dose is very small. In overdose, these drugs can cause severe respiratory depression, hypotension, coma, and death. Therefore, their use is now limited mainly to specific indications such as anesthesia and control of seizures. And let us understand the adverse effect of sedative and hypnotic drugs in a systemic manner. The most common adverse effect is excessive sedation, which can impair cognitive function, reduce alertness, and increase the risk of accidents, especially in elderly patients. Another important adverse effect is respiratory depression, which is particularly dangerous in patients with underlying respiratory disorders or when these drugs are combined with other central nervous system depression such as alcohol. Dependence is another major concern with these drugs. With repeated use, the body becomes accustomed to the presence of the drug, and the patient may require higher dose to achieve the same effect. This is known as tolerance. If the drug is suddenly discontinued, A patient may develop withdrawal symptoms such as anxiety, restlessness, insomnia, tremors, and in severe cases, seizures. Therefore, it is essential to taper the dose gradually rather than stopping the drug abruptly. Next, the sedative and hypnotic drugs can interact with other medication that depress the central nervous system, such as opioids, antihistamines, and alcohol. When these drugs are taken together, their effect can be addictive or even synergistic, leading to increased sedation um, and risk of respiratory depression. Therefore, patients should be advised to avoid alcohol and to use these drugs cautiously when taking other medications.